Hi, my name is Nick, and today I'm going to be doing the Trachea Suction video. I'd first start off by coming in. I'd check the medical charts to make sure everything looks okay. I would introduce myself to the patient and check the patient's name and date of birth. I would then close the curtains, shut the door, and give the patient some privacy. Then I'm going to raise the bed up to a proper level and lift the bed up to about a 45-degree angle. And then, as I'm talking to the patient, I'm going to explain the procedure. I'm going to let them know that I'm going to be checking, I'm going to auscultate the lungs to make sure that everything sounds okay. So, I'll do that right now. So there does sound like there's going to be some phlegm within the cannula. So I tell the patient that I'm going to need a catheter to clean it out. I'd also let the patient know that if they feel any sort of discomfort while I do this, they'll raise their hand to stop. So I would start off by then washing my hands with proper hand hygiene and PPE. I would set up the field, putting a chuck on. I would plug this into the oxygen and set it about 10 to 15 liters. We would then take them off oxygen. If I had an assistant, my assistant would breathe the patient as I set everything up. And then after that, I would put on a clean pair of gloves. And I would turn on this machine. This is the suction machine. I would make sure it's set to be about 150 millimolars of mercury, and I would just check the suction to make sure that everything is working properly. And then get rid of my gloves, throw them away, do hand hygiene, and then we're going to set up our first sterile field here. So I'd open this up. Technically, you would not reach over, but get the box, open the saline up, pour some in, and then I would also put on some PPE. Okay. Those are goggles. And then put on my sterile gloves. So how are these? Okay. Throw that away. And I'm going to get my catheter out. Curl it with my dominant hand. It's all tangled. Pull that out. Then this hand is going to be my non-dominant. is a little awkward. Plug it in. Test the suction and make sure there's suction. And now everything is okay. So I wouldn't do this, but then the assistant would take off manual air. And then I'm going to stick the catheter in with my sterile hand a little bit until a couple inches until I feel a little bit of resistance. And then I would start the suctioning and pulling out a little while doing circular motions all the way. I usually would have to do this only one time. Oh, you know what? Before, I already just caught a mistake. Before I would actually put it in, I need to dip it in the saline first, and then I would do the suction. But I would only do this once, and then if I needed to do it again, I'd give them 3 breaths of air. They'd also get 3 breaths of air before I stuck this in as well. So they do 3 breaths of air, and then I would do it again one more time. I would stick it in saline if I needed to do it in the mouth. The same thing in circular motions, but I would never go back into the trachea if I did it in the mouth. It's only in one way. So now that we're done, we would put this up. Turn this off. I'm going to take off and take the cannula out. Wrap it together, throw it away, and do proper hand hygiene. And now I would open this up. I would take my saline, open it, dump a little in the garbage because it's been open, and then I would dump a little bit into the container here. And I get my second pair of sterile gloves. This might be too small. Okay. You could toss that in the garbage. I would set up my sterile field. While I'm doing this, the patient would be manually breathing or be put on oxygen as they wait for me. Okay. Now that that's out of the way, you know what? Okay, so I did mess up. Before I put my sterile gloves on, this needed to be opened up first and put into the container. So I would do that before my sterile gloves. Now that I set on my sterile gloves, I would take the cannula and I would stick it in with my sterile hand. And then the next thing I would do, take the Q-tips. I would clean all 4 quadrants with the saline. then I would use the gauze to dry it off. This end. Then I take padding, put the padding okay. Then I take the strap, put it under. What I would do is I would use my non-dominant hand. I'd hold the plate. I would unvelcro this, slide it out, stick this one in, velcro it, and then do the exact same thing to the other side while always holding the plate. Make sure it's steady. And then when I'd be done, I would clean up. I'd auscultate the patient one more time. Make sure everything sounds okay. And then that will be all. Thank you.